What the heck is a limited code? Hi, I'm Chelsea, the palliative PA, and I wanted to talk about limited code today because I feel like this is a confusing topic and I can't touch on all of it, but we'll start anyway. A full code is pretty self-explanatory, meaning if someone's heart stops, we do everything. The exact opposite of that is a no code or a DNR/DNI, meaning do not resuscitate and do not intubate. So in between though is something called a limited code. Now, depending on your organization, a limited code can be called lots of different things, but in my organization, we have full code, limited code, no code. So full code, limited code, DNR. In the middle, in the limited code, there are a bunch of different check boxes, and they are sometimes offered as almost like a menu. And realistically, they should not be offered as a menu because it makes it more confusing. So let me tell you why this doesn't make any sense and what a limited code is actually supposed to be utilized for. So a lot of times this is offered as the menu of, do you want cardiac meds? Do you want cardiac compressions? Do you want cardiac synchronization or defibrillation? Do you want intubation or ventilation or a bag mask if you need it? Why does this not make any sense? So realistically, a limited code actually should be utilized for someone who says, I do not want cardiac compressions if my heart stops, but I'm okay with intubation or ventilation in the case of pulmonary or lung arrest, meaning the lungs stop, breathing worsens, something happens that I need a tube in my lungs to help me breathe, but if my heart actually stops and I die, do not do cardiac compressions and do not put me through the rest of that crap. Now, how I sometimes see a limited code put on the chart is that someone does not want intubation, someone does not want ventilation, they don't want cardiac compressions, but they do want cardiac meds, or they do want defibrillation. And the confusing part about this is really the code status should only be referred to in the actual case of cardiac or pulmonary arrest, meaning if the heart stops or the breathing stops. But when it says yes to cardiac meds, the person who is saying yes to cardiac meds is thinking, well, yeah, if I only have a problem going on that I just need medications for, then absolutely give me medications. But really the code status should come in when the person's heart actually stops. And to only use cardiac medications in that situation does not make any sense, because if we push meds into a vein where there's no blood circulating in the body, that medication is not going to go anywhere. So really that shouldn't be offered as an option because it doesn't do anything. It doesn't make any sense. But whenever you're just asking this question out loud, the person says, oh yeah, if I just need medication, that's fine, no big deal. But it really doesn't make any sense to just do that. My least favorite thing is to open the chart and click limited code and see this person only wants cardiac meds. Clearly, this was not explained very well. But if I click limited code and I see this person only wants intubation or ventilation, that makes perfect sense, because then if they have COPD or some reason as to why their lungs could become a major problem, they're okay with intubation or ventilation. But if their heart stops, they don't want any of that drama. Let me know if this made sense and if you guys have more questions. And as always, follow along for more.